So the first thing that, I feel like you really speak to that is my favorite thing, is this notion of balancing the immune system rather than boosting it. And
Hmm.
somebody who's coming from, like putting an autoimmune condition into remission over 10 years ago when there wasn't social media and there weren't cool functional medicine doctors out there. What I learned about my immune system and that it was in overdrive. And I just never thought about that. And here I was walking around the world and like at every health food store, it'd be like immunity boosters everywhere. And people really still do talk about it that way, which, sends fear into the heart of a reformed autoimmunity.
Yeah,
And can you just quickly talk? I just got to get that one on record.
absolutely. Yeah, and it's funny because that really is the crux of my entire book. It's the reason I wrote it, actually. So a lot of people might think, oh, she wrote this book because it was COVID. Well, actually, in the publishing world, you start a book, probably 2 years before it's actually published, and it was published in December. Um, so, you know, I had spoken, I had the idea for the book from my patients. So, my background is that I'm an allergist immunologist. That was like my conventional medicine training before I went into integrative medicine, functional medicine. So I had this background of very conventional treatments, steroids and, all this kind of stuff, which is great because it's a wonderful basis of learning. And when I got into the functional medicine space, many of my patients are people who suffer from autoimmune issues or people who suffer from sort of like inflammation, no one knows where it's coming from, or chronic GI issues or allergies or whatever. And that question was often posed to me like, okay, I have an autoimmune disease. Does that mean I'm immune suppressed? Does that mean I have a weak immune system? Or I'm inflamed, does that make me more susceptible to diseases, et cetera? And so I actually really just started thinking about this concept of, this is something that needs to be clarified, and also something that I need to clarify for myself. Like I need to get into the literature. And then also, as you know, on social media, you see that a lot, and you see it even when you go to the drugstore or the Whole Foods, right? That this whole concept of boosting for everyone. And the reality is that, our immune system is not this like black and white, two-dimensional up-down system. It's multi-dimensional. And we need inflammation as much as we need inflammation resolution for everybody. But most of us are somewhere along the spectrum that, of course, can change throughout life, that we might be inflamed, which would be someone who maybe doesn't need boosting. They may have a really robust immune system. Same with someone who has autoimmune disease. It does not mean that because you have autoimmune disease that you cannot fight off, bacterial infections or, viral infections, et cetera. There are times in our life and situations that we do become immune suppressed with aging, with medications, with chronic stress, et cetera, with poor nutrition. So there are times for the boosting message, and then there's times that that's not really what we should be doing. We should be looking to balance what our immune system's doing. So,
and what are, and when we'll go beyond, I feel like our community knows the effect of sugar and alcohol. I definitely want to get into stress, but we'll maybe touch that later. But just like, the low-hanging fruit of knowing the effects of sugar and alcohol on the immune system, knowing the effects of sleep, knowing the effects of movement and sunshine and eating a rainbow diet. But kind of getting into this notion of daily care for your immune system rather than not considering it, and I feel like we're really taught in this culture to like, oh, you think about your immune system once you're sick.
When you're sick. Yeah.
Which is so wild to me. And if you could just give us some inspiration around considering the immune system every day, little things beyond, what we just mentioned. Maybe it's like supplementing C, D, and zinc is like this daily step to take, or just other things you do to care for yourself daily?
Yeah. Yeah. I mean, I agree that we have sort of a reactionary approach just in general with our health, right? I mean, many people do. I shouldn't say everybody does, but especially in the conventional medicine world, is that we wait until things fall apart. And that's also because we're taught that, like, oh, you don't have to do anything until something happens. And we get that message even if you go in and you might have experienced this when you go to your doctor and you say, I think something's wrong, I'm having this ache or pain, and then they say, oh, it's fine, so fine, it's fine, your numbers look good, whatever, we're just going to wait until things get really bad, like until you get a real symptom or until you get a very abnormal laboratory. We're just going to sort of ignore the fact that you're not feeling your best, and you just so ignore your intuition. So that's the message that we get driven into our head when in conventional medicine. And I agree with you 100%, is that we need to be thinking about maintenance, right? And maintenance of your immune system is super important because it's literally it's the system that has its sort of tendrils into every part of our body. In every organ system, our immune system plays a significant role through this all of the different cells that regulate immunity and also inflammation. And so you really can't get away from it. And so I agree, you have to think of when we're thinking of, like, well, why do we sleep, right? Why do we have to be really consistent with our sleep and sleep quality? It's because it's an important time for our immune system to be active. It's also, we know that when we don't get enough sleep, we get more inflammation, we aren't able to clear out toxins from our brain. So there's these things that that's what I think about. Like, when I go to sleep, I literally go, not only am I going to feel better tomorrow, but I know this is going to help me age better, this is going to help my immune system fight off infections, this is going to help me be healthier. And so I do think that that concept of small daily habits is a wonderful concept. So whether it's when you're eating your food, and I mentioned this in my book, is one of the reasons why I think it's important for people to know, what an antioxidant is, or, why you are, say, taking turmeric or drinking turmeric tea, so that when you're actually doing it, you can say, I know what this is doing for my body. This is actually helping me decrease inflammation. That's why I'm drinking it, right? It's not because, oh, it tastes good. Or, I know why I'm moving my body. It's not just to make me look thinner or whatever. It's actually to improve my immune system, to help me with aging, to help my brain health. So, I think if you can attach, like, an outcome that is important to you, and make you more likely to do them, right?
Awesome. I love that. And I agree.
Yeah. Yeah. I mean, we all
Um,
need a little kick, right? We all need to have that thing that keeps us going.
I mean, you just touched upon it, but what's some really juicy, surprising, wild stuff that the immune system is responsible for and touches? I mean, it touches everything, but for someone to
Mm-hmm.
really pull out of, like, oh, I have the sniffles, it's my immune,
Mm-hmm.
you know what I mean? To pull
Right.
out of that, and we'll kind of go into, like, brain and mood and skin stuff and
Mm-hmm.
dig into that. But is there something that's just like, wow, blows your mind every time you hear it and think about it, that really shows how far and wide and how it is touching everything?
I mean, I think what is pretty amazing is that we have our immune system is involved in even things that are so primary to human development, like growth, for example, right? So we actually, you cannot grow a bone, you can't heal something, you can't actually build muscles without tearing things down and bringing them, and then making, what we call fibrosis or hypertrophy. You can't, you actually can't have, you can't have a child, right? You cannot go through childbirth or actually create a child without having your immune system be very activated. And part of that has to do with the fact that, when you do have a child, when you're carrying, a fetus, it's partially not your DNA, right? So you've got DNA from another person, and your immune system has to actually prevent you from attacking it, right?
Mm.
So the whole we have changes in our immune system that are necessary for the human race to continue, right? So and your immune system actually changes during pregnancy, throughout pregnancy, and then giving birth, and then healing. So it's like, it's, again, we think of it as being associated with protecting us from germs, but actually it's involved in things that we wouldn't even think about, like, so growth, development, childbirth, super super important. So I think for me anyway, I think that's something for people to think about when maybe something is not going well in their life, that they don't even associate with like an infection. They associate it with something else that is not, maybe going right, or not healing. You have to think about your immune system is not balanced, or something's going wrong there. So
Mhm.
yeah.
Okay, that's awesome. That gives us great perspective to think about it. And I've been thinking about this thought a lot of, that the immune system ramps down when you're pregnant because you do have that foreign DNA, and that, you know,
Yeah.
sometimes why some women feel so much better when they're pregnant,
Mm-hmm.
and why the postpartum can be a little rocky, and there's like
Mm-hmm.
skin issues that flare up, or
Mm-hmm.
all types of things. Um, is there anything you see postpartum where, it's like, oh, these four things that usually happen, like that's an immune system ramping back up
So
issue?
normally I would say the only time I see things is if, it's something that is particularly disruptive. And we know that probably for lots of different reasons, but postpartum or can sometimes cause a change in, our tolerance, right? So there's that, we have to tolerate the cells. And that's sort of a very inherent part of our immune system, is that we have to know how to tolerate our own cells and not attack them. Um, there seems to be a shift that can happen sometimes after pregnancy that can increase the incidence of autoimmunity. So, and that's why there is an increase in, for example, thyroid, problems, both Graves' disease and Hashimoto's. So the two major forms of, autoimmune thyroid diseases, that we know of. We often will see that occur postpartum. So that could be one. Some people, and I don't know how much of this is true, there's sort of some literature on it, that maybe some of the postpartum depression might have to do with some changes in immune regulation, um, and maybe not, necessarily just, and that might be mediated through neurotransmitters, it might be mediated through inflammation, we don't really know. So that's another thing. I don't see a lot of skin issues that occur post, pregnancy. We sometimes do see the resolution of skin issues during pregnancy that come back. So for example, eczema and, sometimes hives, can calm down and then maybe come back, but I think it's just that, things have changed. And asthma too. So asthma is sort of funny. Some women might get worse asthma during pregnancy. Some women who have asthma might get better. It's and again, we don't know why that is, but there's definitely a change.
Makes sense.
Mhm. Yeah.
Makes sense. And then, I think there's probably a lot of people in our community that have specifically gotten Hashimoto's,
Yes.
postpartum. I know
Mhm.
that, I can look back and track it, and it's like, well, I think I had Hashimoto's for a
Mhm.
while. I was in this autoimmune state, but it was manageable-ish.
Mhm.
And it was postpartum when it became completely
Mhm.
unmanageable, and I needed to deal with that. What are
Yeah.
the specifics in that?
In terms of why it comes up then,
Yeah.
or
Yeah, in the postpartum. So is it that your immune system ramps down when you're pregnant and then
Mhm.
comes back
It,
even
yes, it could be,
later?
because you think about it, a lot of people have autoimmune antibodies against their thyroid and they would never know. I mean, most people probably go for years and years and years with low level fluctuating antibodies that are directed against the thyroid. And you can live that way for years because your thyroid function is relatively well maintained. So it could be that they never knew that those things were there.
Mm-hmm.
So what may happen is postpartum, that reactivation of your immune system, that boost that you get sort of postpartum, may also increase the production of those antibodies to the thyroid, or what we call self tissue. So that might be part of it. That's one theory. And then and that's sort of what brings on maybe more of the symptoms, whether it's fatigue or some people actually get postpartum inflammation of their thyroid. So you can get what's called a thyroiditis. So they get like a little bit of a swelling that happens, and they end up in the ER with losing their voice, or they have appreciable swelling of the neck, and they end up in, oh, you've got postpartum thyroiditis. So yeah, so that's one of the reasons that we see that.
Interesting. Okay. And then this stress, chronic inflammation loop, I feel like, again, is indexing high in our community. And it seems to go, I think we're dealing with a population that understands the effects of gluten and sugar and alcohol and processed foods and all of those kind of more obvious inflammatory things. We're really dealing with people that have spent years on an autoimmune protocol, avoiding seed oil. I mean, really doing all the things, and still seem a little stuck in this chronic inflammation loop.
Yes.
Stress seems to be the one thing where it's like you can avoid all these food and all these behaviors, and like, stress is still there, and you're doing all the things, and you're meditating, and you're walking, and you're trying hard, but we're still kind of stuck in this stress inflammation loop. What is it?
I would say that stress reduction, or what I would say, I like to call it maybe more intervention, stress intervention, because I don't think you can't get rid of stress, right? That's impossible. Is the hardest behavior for us to do consistently. Part of it is because stress in general is omnipresent, right? So nobody lives in a world without stress. That would be, it just doesn't occur.
That would be him.
Right. And many of us have more stress than others, but actually outside of major traumatic events, it's for the general, just to say the general population, right? The general population who isn't in an abusive relationship, or isn't taking care of someone who's dying, or is, just maybe has like the regular day-to-day stress of like finances, or some problems in their relationship, or watching the news, or blah, 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 right? So just regular old chronic stressors. The issue is, how do you intervene on a regular basis and learn how to regulate your physiology so that regardless of the stress that's around you, you can slow or sort of soften the blow that those messages from your brain then change your physical state or change your physiology? Because it's not the presence of stress out in the world that does the damage. And everyone probably knows someone in their life who has an unbelievable amount of stress, and yet they seem to just be able to like throw it off, be fine, really sort of be unaffected. When then there's some people who it's almost like they invite stress in, and everything is such a shock to the body, and everything is so debilitating. So there's this spectrum, and part of it is biochemical, so we know that, and genetic. We know that some people have certain ways of metabolizing neurotransmitters that make them more sensitive to adrenaline. So we know that's true. We know that some people have lower levels of dopamine at baseline or higher levels of dopamine at baseline, and this has to do with how they metabolize these neurotransmitters, et cetera. But really, all of us can learn how to take the messages that are coming from whatever stress it is in our environment from our brain, and then before it makes its way down to activate adrenaline and noradrenaline, which is the other we call sympathetic neurotransmitter, and then finally cortisol, which is our major adrenal hormone that modulates or I guess yes, modulates stress. It's knowing what works for you and practicing it daily. Because you can't just be like, oh yeah, I meditate once in a while, or like I meditate, but do you take those lessons of controlling your breathing, your thoughts, your emotions, do you take that out into the world with you so that when you are feeling that way, you can change your state, right? So that's what all of us need to learn and practice. And I think that's where, many of us fail, including myself. I'm not saying that like this is something that I'm able to do all the time, but being mindful that this is something that you can learn, but it has to be practiced, and it has to be something that's transportable, right? That you can use in the moment. So that's sort of like my idea around learning how to modulate stress. We can't always escape it. I mean, certainly we can have behaviors that are healthier for us. I feel that some people do have a little bit of an addiction to adrenaline and dopamine. We know that, right? So we often are pulled to things that we should not indulge in. And usually that's drama, usually that's, violent TV or watching the news or things that like, it's like watching a car accident, right? Like we want to watch it. It gives us that feeling of adrenaline or that feeling of dopamine. But in the end, over time, it's actually very damaging because it starts to stress us out.
Yeah. Yeah. I feel like also sometimes it's just maybe growing up in a chaotic household, and we're trained from such a young age that there's like yelling and fighting, and door
Right.
slamming, and you're kind of wired for that. And as you go out into the world, it is harder for your system to just settle and to not seek out these big reactions and brain really flooding. And I think, probably in relationships, people have that too, of like, is this even passionate if we're not having,
right,
these wild things? Yeah. I like how you talk about that there's the meditation, but then how do you take it into the world, apply it to almost every moment? I don't think you can apply it to every moment.
No, of course you can't. Yeah. And so, and I love meditation. I think over time, and it's definitely the studies that they can do that are sort of controlled. It's hard to do controlled studies on meditation, but, we know that from looking back at like very, very, very daily meditators, they do have a higher resilience to stress, and they do have a greater ability to sort of engage that we call parasympathetic nervous system, which is, the opposite of our fight and flight. It's sort of like more calming. We know that they can do that, and we know that they can change their physiology. So when they've looked at all these monk studies, even when there's not something stressful going around, just through meditation, they can lower their heart rate to ridiculously low levels, their blood pressure. They can have control, through their mind, of systems that, we think sometimes we don't have control over, but we can learn that, but it takes time,
It does. I always think of meditation as just the brushing the teeth. And it's then what happens, like, what do you go out and do with your clean teeth?
Yeah, exactly.
There's like this attachment to like, well, I had a meditation and it didn't feel very meditative and it was a bad one. And it's always like, there is no bad one. If you sat and did the work, it's like, you're
Yeah.
brushing your teeth and you've set yourself up
Yeah.
for
Well,
help.
I, if you simplify meditation down to, it's very basics, it's being present, right, and mindful. So you're actually you're present in that moment. And I think all of us, when something happens to us, just say we get like, cut off and we're on the highway, many of us are very reactionary and we go to behaviors that maybe we learned, as you said, that you saw like your parents do, or like something that you've been practicing for over and over and over again. And so it's so ingrained that our reaction is to scream and yell and get upset and, in a really foul mood. Whereas we can, in that moment, when we start to feel, and this is sort of almost like cognitive behavioral therapy, when we start to feel or we get that thought of like that person's a jerk, before we allow it to just hijack our entire nervous system, we can be like, okay, wait a minute. Like, maybe, okay, I don't have to become angry. I don't have to be a yelling crazy person. And I don't have to like jack up my nervous system. I can decide to have a different thought. I can decide to have a different emotion, and I can actually control this moment. And once we start practicing that, that really, really, really helps. So I think that, and this is something obviously that therapists and teach, people all the time is, you can take that thought and turn it around to something different. And you can really sort of change the way that your body ends up reacting.
Yeah. Yeah. It's like that grandmother wisdom. My
Mhm.
grandmother would always tell me as a child, there's no point in being angry. It only hurts yourself. And I remember her saying that, and like, I'd be like, I
Yeah,
don't know
come
what that
on.
means. But later in life, it's like, wow, that was even on a biological level, is that
Hmm.
moment of you yelling at someone in a car. They don't care. They're driving
Right.
off.
They're driving off and you're the one who's upset for the rest of the day,
Yeah,
right?
it's
Yeah.
like you've got the chemistry in your body now, and you're gonna have that
Hmm.
inflammation, and you're gonna be in that loop. And yeah, some little inspiration to
Hmm. Yeah.
not become angry. Um, okay, what's surprising stuff that's linked to inflammation?
Surprising. Um, so, one of the things that I like to talk about a lot is that inflammation, I think that we've sort of created inflammation to like this monster of it's all bad. When actually, we need it. We'd all be dead if we didn't have inflammation. Um, but you know, there's sort of two sides to it. You can decrease inflammation by getting more sleep and not bringing stuff into your body that is pro-inflammatory, chemicals, toxins, alcohol, like you said, like things that would make you more inflamed, smoking, whatever it is. um but you can also, we're chronically creating inflammation as we go through our day, right? It's just part of what we do. When there's cells dying and being born, and we're putting out fires, all the time. So a lot of it is resolution.
Mm.
So can we can we make sure that our body does a good job at resolving the inflammatory mess that's left over? So um, it's sort of like, say you're making a big meal in your kitchen and you use every pot and everything. You're not doing the dishes as you're going along. So at the end of the night, you've just got this complete, absolute, utter mess, right? Um, Whereas if you can sort of keep up with it and resolve inflammation as you go along, you're not going to be left with a lot of collateral damage. And, a lot of that is, anti-inflammatory foods, um, and things that help resolve inflammation, like omega-3 fats are a main part of that. But also the other thing is understanding that we have sort of, I don't want to say it's a limited ability to keep inflammation under control, but we sort of do, in that if you are burning the candle at both ends, like you're not sleeping, over exercising, or even, being sedentary, or and very, very stressed, and then eating a lot of bad foods, like what happens is over time you get inflammation sort of all over the place. And it's hard for the cells that actually do cleanup, like we actually have cells that clean up inflammation, and the nutrients that we need for that. It's hard to keep it up. And that's how you get into like that chronic inflammatory state. It's usually problems with bad stuff coming in, or bad habits, or things that we are doing to cause inflammation. But then also we might be shortchanging ourselves on resolution of inflammation. And so think of it as like really more of like a seesaw,
Yeah, that was you're describing one of a low point in my health, when I felt like I'm doing everything and I'm doubling down, and I was losing sleep to get up to meditate, to like really meditate, and just waking up too early.
Yeah.
And then exercising 3 to 5 times a week, because that
Mm,
felt like it was going to be good, which would then force me to, the hour or two that I lost during the workday, to stay up
yeah.
too late. And so here I was, just not enough sleep, and too much exercise,
Yeah.
and visible inflammation in my
Hmm.
body and face, and so many problems that came from that. And all of the cryo that I did, and the like radical measures that I was taking to combat inflammation, really all I did was I stopped working out like that
Yeah.
and started taking walks, and
Hmm.
prioritized 8 hours of sleep, and could
Hmm.
drop all these like expensive,
Right.
extravagant measures.
Yes. Yeah, I see that a lot, and I think it's from an attempt to be proactive, which I appreciate, and I want to encourage people to do all the things that make them feel good. But I think sometimes out of desperation, we end up stressing ourselves out more, and I would say that that's true. And a lot of times I have to tell people to cut back on exercise, to sleep more, to give things up, to like not be as involved in clubs or things like that, and just really just like take a break, like treat yourself like you're a little baby. And what would you do with a child that is just like overwhelmed and crying? You would just like put them to bed with a bottle. You know what I mean? Just and sometimes we need to think of ourselves as like a little baby, like we just need to like calm down, not try to be doing all the things, because and I think that there's a lot of, in the wellness world, and this is something that does sort of drive me crazy sometimes, that there's just like a lot of hustle culture in
Mhm.
business, but even in the wellness world, of like being perfect, and getting up and doing your 20-minute hit your hit workouts, and then you're plunging into an ice pool, and you're you're being so strict with everything that you put in your mouth, and so to the point that it's like, if you accidentally gluten yourself, you're freaking out. So this sort of like extreme wellness sometimes can backfire when we're just trying to like heal ourselves.
And so when we rest and relax and get to be little babies, is that when what is actually happening? Is the immune system coming in and cleaning up all of that debris that leads to inflammation? Or I mean, is that just an overly simplified way of putting it, or is something else happening?
Well, I would say that, sleep is, first of all, it's like paramount, right? So that is, a lot of us don't get enough sleep, or we get poor quality sleep. So that is probably the number one thing that people can focus on when they're sick, obviously, or if they're dealing with a chronic disease, is to, if I had to pick one thing, I would say focus on your sleep more so than exercise. Exercise is amazing. I love it. I mean, obviously it's necessary. It can lengthen your life, of course. Um, but in the short term, it can be very pro-inflammatory, right? So when you go and you, even say if you go running, right? Say you're training for something and you go for a run, that puts a lot of stress on the body, and then you have to recover from that. And So same with like if you're lifting weights is great, but you're tearing muscles and you have to repair. So anything that's I guess putting too much of that bodily stress on is usually something you should cut back on for a while. Like you said, walk, do some more gentle yoga, like just move your body, right? Breathe. That's a good thing to do. And it sort of allows your system to catch up, lowering inputs of inflammation. And then once you get to a point that you're stronger, you can add in these extra stressors. So, with exercise, we call it a hormetic stress, or like a good stress. So it stresses the body to make it stronger. But if you're already in a state of too much stress, then it's not going to give you that positive benefit, really.
I do. Okay, I have two faves that I'm gonna get you to lean into, but my first fave is inflammaging.
Mm-hmm.
Can you walk us through it and just, I mean, I think we all know the basic concept, but like,
Yeah. So, obviously we haven't figured out how to live forever, right? So there are things that occur as we age, obviously, and some of these are genetic. A lot of these things are environmental, but as we age, we tend to have an increase in low level inflammation because of the buildup of what we call oxidative stress. So oxidative stress occurs because we are creatures that breathe oxygen. So if you look at the level of the cell, we use oxygen and water to actually create energy, along with the foods that we take in, and we create these basically free radicals. So free radicals are things, they're loose active electrons that basically can damage our cells, and they need to be neutralized. So you need things to neutralize them, and that comes in the form of antioxidants. So over time, our body becomes not as, let's just say, efficient, right, at getting rid of these reactive oxygen species. We tend to have more oxidative stress. We also tend to have a buildup of like older cells that become what they call senescent cells. So it's almost like they fall asleep. They become less active. There are ways to counteract this a little bit, but those senescent cells can actually create a little bit of an immune response, a little bit of inflammatory response. So we have an increase in these cytokines that are pro-inflammatory. We also have a slight decrease in the strength of our our adaptive immune response, that's like the more specialized part of our immune system. So we have not as good as making antibodies to things, not as, just not as quick to respond. Our innate immune response can sometimes be because of that, a little bit more active, but again, it's not a very, our innate immune response is not very specific. And so there's this change, that all of these changes over time create this slight inflammation. So basically, if you think about it, it's mild chronic inflammation that sort of creeps up and can cause cellular damage and accelerated aging. Now, granted, if we do all the things right, all like if you sleep and you exercise and you get good quality foods in your body and you're doing all these things, you can lower your rate of inflammation. So that's sort of the way to think about it. It's not something that's stimulated necessarily by bacteria or viruses. So this is like, they often will call it sterile inflammation, right? So think about it that way. But yeah, it's a big topic because for the longest time we weren't really sure like what all the input was in terms of the aging of our cells.
And what are your favorite antioxidants? What are you personally supplementing with daily and you feel like is helping the cleanup?
Yeah. So, antioxidants are a whole bunch of different things. Some of them are really easy to get from foods, and some of them aren't so easy to get from foods. I would say that even when we looked at studies, probably the biggest ones would be ascorbic acid or vitamin C, which everyone sort of knows about, because it is so effective as a free squelcher of free radicals. Other things I would say, not quite on the same level, but vitamin D, that's really more of an immune regulator versus like a straight up antioxidant. And there are a couple of antioxidants that people don't think about. One is vitamin E, because it has mixed data when it comes to supplementation, but making sure that you get enough of these forms of vitamin E in your diet, I think is really, really, really important. And then I would say, I mean, there's some other ones like selenium. I personally take vitamin C and vitamin D on a regular basis. One is because vitamin D, I think everyone should take because I don't care where you live in the United States, you don't get enough of it. Because unless you're a farmer or you work outside, 6 hours, 5, 6 hours a day, you're probably not getting enough through your skin, and people wear sunscreen, et cetera, et cetera. So, and it's really hard to get through food. Vitamin C is very easy to get through food. The problem is vitamin C is used up very quickly. It's not stored in the body very well at all. Whatever you take in, you use, and then you excrete. So you literally have to get a vitamin C on a fairly regular basis.
Like that 4 to 6 hour window is what it has active.
Right. So, in terms of supplementation, if you're taking a supplement, you can only absorb in the intestinal tract a certain amount, say 500 milligrams, say within a couple hours. And so you can take high doses of vitamin C, and some people advocate that, but the reality is probably most of it you're excreting and not really using. But
does it matter if it's lipospheric? Do you feel like that helps if you're taking it orally?
I think it does help. It does help keep it around for longer and helps you hold on to it for longer. But I personally just take regular old vitamin C.
And even though we don't advocate for drinking, if somebody was going to once a month go out and have a drink, would you recommend doing something like taking glutathione, taking vitamin C, maybe before and afterwards? Is there anything that can help with just some of the wreckage there?
So one drink is probably not going to make a difference, quite honestly. I mean, the amount of stuff, toxins and stuff that we just get in like through the air and, our food and, water, et cetera, probably is probably way more than one drink. But if you're saying like, oh, I like to have a drink 2 to 3 times a week, that's going to give you a little bit more of a burden, right? So the thing is with alcohol, it's ethanol, right? So ethanol is not a substance that we actually use alcohol as a macronutrient. It has calories in it. And that's why one of the reasons why people gain a lot of weight, right? When they drink a lot. So it has 7 calories per gram. And we know, obviously we know that you can use alcohol for fuel. So it is a fuel. The problem with ethanol is that when you drink it, it gets broken down in our liver to these intermediates. It's the intermediate, because we have this whole system in our liver that, detox pathways 1, 2, 3, like it gets broken down to these very problematic metabolites, which those are the things that the liver is like, okay, we need to neutralize this because this can cause liver damage and cell damage. And I mean, there's other issues, right, with alcohol. But so I would say like for that, yeah, I mean, there's no disadvantage in taking a little glutathione, taking some N-acetylcysteine, which is cysteine is one of the amino acids that makes up glutathione. So, we know that can be that can be helpful. And then of course, vitamin C, and then you can use other things to just protect your liver in general from damage. So, um, I'm a big fan of milk thistle, love taking that. Um, that can be really wonderful. And alcohol depletes other things too. It depletes B vitamins. We know that obviously it depletes thiamine, which is B1, which is it can really be problematic for your brain.
Mm-hmm.
So, over time, I think that more moderate consumption of alcohol is more of an issue than someone who's like, oh, once or twice a month, I'm going to have a glass of, wine. Usually that you're going to be fine with that and you don't have to do anything. Yeah.
That's celebratory news for some.
Well, it's funny because, I always say the caveat that we've never, we've sort of debunked the myth that it's actually helpful for your heart or anything. We know that's not true. And there was a recent study that showed that even people who drank like one glass of wine a day, that's still 7 glasses a week, right? So that when they looked, I think it was a study that was done in the UK, when they looked at their brains, they did brain MRIs and they found that people who were just, what we would consider to be moderate, one drink a day drinkers actually had about a 10% smaller brain size, or I can't remember which part of it was, but there was shrinkage in the brain compared to people who didn't drink at all. So that's sort of sobering,
Definitely sobering.
You're like, oh God, that sort of takes the fun out of it, doesn't it?
Um, okay, my other favorite, and these kind of like, I'll throw it all out there and I think you'll want to unpack them in different mini modules. But and then I've got a few questions and then we'll go into lightning round. But the lymphatic system, I'm just obsessed with. And I feel like community, knows the basics of it, but is there anything about the lymph that you would want to share and maybe the interplay with inflammation and the immune system? I feel like you touched on the glymph earlier by just talking about sleep and getting the junk out of your brain.
Yeah.
But kind of this like lymphatic and then moving into glymphatic and what that does for brain fog and for mood.
So, I mean, just in general, I mean, you just start with the lymphatic system. Like, we sort of forget sometimes about the lymphatic system. We have obviously our circulatory system, which is arteries, veins, capillaries, and we have, red and white blood cells and all that kind of stuff that travel through there. But we have lymph nodes all over the place. We've got at certain parts of the body, like so they're, in our head and our neck. I mean, we've got lymph nodes everywhere, clustered under our arms, our groin, around our gut. So, lymph nodes are where a lot of, many of our cells are born and created and also sort of hang out, sort of like battle stations, right? However, when there is a signal, like say you get cut or something happens to you, they pour out of, whatever lymph node is nearby, or whether it's coming from another organ like the spleen or something. And they use the lymphatics to actually move to different areas. And then eventually they will go into, they can go through the walls of the circulatory system. So the lymphatic system is a very, it just contains this sort of clear lymph fluid. There's no red blood cells in there. It's not oxygen carrying. So it's important to have a healthy lymph flow. And we know if people have probably known people who've had lymph nodes removed, maybe after cancer, and they get, fluid that accumulates and they get swelling. It's really important to keep those lymphatics open and moving. And that's why like lymphatic massage is really good. And this is why exercise is actually really good, because lymphatic vessels don't have muscles. So they're not like arteries. They don't really move on their own. They require our muscles to sort of move things along. And, so things like exercise, things like massage, things like lymphatic brushing, all that's really, really, really helpful. So you want good lymph drainage. The other thing is that, that idea of drainage, things that then like waste material, obviously we have waste that goes to the kidneys, we have waste that goes to um, right into the bowel, right? But we also have waste that comes into the lymphatic system that also gets dumped out too. So it's an important part of just our overall health. And in
Mhm.
the brain, what you were referring to is that and it's amazing that they actually just discovered this system like, a few years back, is that um, we have a separate system inside the brain, because the brain is, although it's not completely walled off from the rest of the body, we used to think that was the case. We have a blood-brain barrier, but it's not completely impermeable. But it does, our brain does have its own set of sort of immune cells that are specific to the brain, and it has its own little glymphatic system. So the glymphatic system is basically right outside, um, sort of between the exterior of the brain and the immune cells that are called these microglial cells. So what happens is when we sleep, and this is another reason why it's so important, is that our brain actually slightly shrinks while we sleep, just a tiny, tiny little bit, to allow these glymphatic channels to sort of open up, where we have cerebrospinal fluid, and a lot of the debris from the day, and even things like plaques and tangles and what are called tau proteins, all this stuff that collects in our brains, and especially in like Alzheimer's disease and things like that, it all goes into the lymphatics and it gets removed from the brain. So it's like, the people who discovered it called it the dishwasher, sort of, or the washing machine of the brain, which is really sort of cool. So yeah, so our lymphatic system is very, very important, and we often don't think about that.
Yeah. And do you think that do you think it plays into brain fog or depression?
Um, so I would say yes, for sure. I mean, when we, for example, if you, let's just say the example of like not sleeping, right? So you could probably bring on the feeling of being hungover just by not getting enough sleep, right? Because we don't go through that glymphatic cleaning cycle. So just that right there makes it less likely for us to have really good, fast neuronal connections, right, in the brain. So the neurons, firing, and we use neurotransmitters to help transmit those chemical messages. So certainly that plays a role there. In terms, of course, there are other things that can make us inflamed in the brain. I see this all the time with sugar. So sugar can do that. Excess sugar, inflammation coming from the gut can be transmitted via the vagus nerve to the brain. So this happens a lot in people who have food sensitivities, et cetera. We know that certain people have cross reactivity between gluten and certain parts of the brain. So, in fact, there's a whole for people who have extreme gluten sensitivity. There's something called gluten ataxia. That when people eat like a piece of bread, within sometimes just a few minutes, they will actually start to get dizzy. But a lot of people just, they might feel like brain foggy. Same thing can happen with casein, which is in dairy. Some people can have cross reactivity between dairy and receptors in their brain, or tissue in their brain. So yeah, so that you can definitely have this sort of increased inflammatory response in the brain that translates as feeling foggy. And I would say that most people just say like they just feel like they're not sharp, like they just, either they can't really concentrate, or they have to read things several times over, or they're just not as fast. So I would say processing speed sort of slows down. um and in terms of depression, we know that there's a huge connection between inflammation and depression. When they've looked at studies in depressed individuals, many of them, or a disproportionate amount, have higher levels of inflammatory cytokines and even something called C-reactive protein. However, you can't say that inflammation causes depression. There's probably many types of depression and why people are depressed, but there is a role that inflammation can play in not just depression, but anxiety and other cognitive and mood disorders. So there's definitely a relationship.
Okay, thank you for that. And then my last question, and then we'll go into the lightning round, but is our skin part of the immune system?
Yes. So our skin is part of our innate immune system. So it's part of the barrier. And we don't think about this sometimes, but even so, our skin is part of the innate immune system. Your saliva is part of the innate immune system. The basically mucus in your nose and your sinuses, tears. So these are all we consider barrier or barrier fluids. And the immune system, not only is it a barrier that keeps things out, but there are also really important cells that sit right underneath, sort of the surface of the epithelial cells. So two that are super important are mast cells. A lot of people think of mast cells. Those are the things that create that if they are releasing too much histamine, you get hives, right? But mast cells are a really important part of our immune system. They do a lot of other things besides make us itchy. The other thing is dendritic cells. So there are these really cool sort of starfish shaped cells that are a really important go-between between our innate immune system and our adaptive immune system. They can actually carry messages from the surface, often from the skin or other surfaces, to down to lymph nodes, down to the gut, to sort of bring in information to then make further decisions. So I like to think of the skin as not just a barrier, but also as a way for the rest of the immune system to get information. So yeah, and also inflammation shows up on the skin. So it's sort of like a mirror of what's going on inside as well.
So I love this, and it's helped me reframe so much thinking around skin and skin care. And it's reframed a lot for me. Can you say again the beautiful starfish? What are they called?
They're called dendritic cells.
Dendritic cells. So is it like the skin is there, it's receiving messages about the environment? So something weird that you may be putting on your face every morning and every evening, thinking you're taking care of yourself, is potentially the dendritic cells would be the messenger that would take alarming messages down to your lymph and gut and say something's wrong. And is it bi-directional, where then the dendritic cells could get troubling information from your lymph or gut and have it show up and cause like eczema or even just sensitive skin?
Yeah, and so it makes it a little complicated, but we also have T cells that are sort of in the skin too, right? So T cells are part of our adaptive response, and they are responsible for causing sort of delayed type reactions. So, for example, poison ivy is a classic, or reactions like to cosmetics or metals, like nickel is a big one. So people who have that kind of sensitivity. So yes, there is a go-between from the skin surface to these sort of centers of control, as I like to say, either in the gut or other parts of the body, and then back again. And obviously we have so many different kinds of skin eruptions. We have allergic skin eruptions, and those can be immediate, like a hive, or it can be delayed, like something like a nickel allergy or a poison ivy reaction, which doesn't show up usually for like 48 hours, sometimes 72 hours. And that's because the actual immune response is different. and then there's autoimmune changes that can occur in the skin too. So lots of different, the skin is a really incredible, I would say it's like a mirror. It really can tell us what's going on inside the body quite often. Yeah.
That's amazing. And
Yeah.
those immune skin changes, I mean, I'm familiar with just like the more thyroid ones where it's
Mm-hmm.
dry skin.
Mm-hmm.
Uh, are there other
Oh, well, and there are skin conditions that are, there. I mean, I would say there's autoimmune diseases that are specifically skin based. So, for example, psoriasis is one of those.
okay.
It can affect the joints too, but it's primarily a skin issue. Then there's some more rare, there's a bunch of really unusual ones. But even vitiligo. So vitiligo, loss of
Mhm.
pigment. You see this more in people with darker pigmented skin. That is a loss of pigment, and that is autoimmune in nature. So there are primary autoimmune diseases of the skin, but then, for example, people who have rheumatoid arthritis can develop nodules in their skin. We know that people who have gluten sensitivity can have an unusual skin reaction that usually is like itchy nodules on their elbows or sometimes on their back or their buttocks. So yeah, it's there's a lot.
Fascinating. Okay. Lightning round.
Okay.
COVID hair loss.
Oh gosh. That is not something I know a lot about. It is, what I do know is that coronavirus, well, I mean, now there's a couple of different variants and things, but the coronaviruses seem to be able to attack, or I don't want to say attack really, but get inside of numerous bodily tissues. Initially we thought, oh, it's just attacking this ACE receptor and it's primarily a respiratory disease. And then we started to see things like cardiomyopathy and brain fog and, things that didn't have anything to do with lung tissue. So there are some case reports of hair loss, but it's unclear why that is. Is it because it's causing an autoimmune hair loss? So we know that you can get alopecia, which is, or hair loss from an autoimmune, response where you're actually having destruction of the root of the hair. Or is it related to a stressful event, which we know that can also cause hair loss, and we see that quite frequently. So the question is, we don't know. I would put my 2 cents in the autoimmune bucket, but
Interesting. Okay. I was going after mine as if it was, more of that stressful or stress event intelligent. This
yeah.
is my third or fourth period of hair
Mm-hmm.
loss I've had. So I've
Mm.
with my first child,
Yes.
that more extreme hair loss. I've had it around some autoimmune thyroid stuff for sure. I had it with COVID, so I was no stranger to it.
Mm-hmm.
But yeah, always looking for insight there. And it seems like if you're a candidate for it, if you've had postpartum hair
Mm-hmm.
or post surgery or something like this, that COVID maybe is a place where you might experience it 2 to 3
Mm-hmm.
after infection.
Mm-hmm. Yeah. And so in that case, there's a potential it could be more stress based. Usually with autoimmune hair loss, it either doesn't come back or it takes a really long time to come back, and usually requires things like steroids and things like that. Whereas, postpartum hair loss usually just resolves itself, the telogen effluvium.
Yeah. Okay, cool. Inflammation and fertility.
Mm. In terms of decreasing fertility.
Yeah.
Mm-hmm. So absolutely. I mean, I think though that most of the time, the issue with fertility problems, of course, it can come from inflammation. For example, in the case of something like polycystic ovarian syndrome. So that is, and that's a whole messy, discussion because, there's so many variations, but we know that there's usually some insulin sensitivity problems with high blood sugar, high insulin, which is pro-inflammatory. So usually higher levels of CRP and things like that, which can get in the way of healthy ovulation. But I would say what I see more is stress and circadian rhythm problems. Like, even though we think of ovulation as being on a lunar cycle, even flying across the country, losing 3 hours can change a woman's cycle for a day or so. We know that stress can do it. We know that loss of nutrients can do it, or too little body fat. So any sort of stressors on the body, because that I think is a real problem. But I will say that I do see people who have gluten sensitivity that's undiagnosed, or severe inflammatory or severe irritable bowel, or SIBO, who have significant issues with fertility. And it's usually because their cycle is irregular, or they're dropping their production of progesterone, sort of mid-cycle. So then they're just not able to get pregnant. So if you look at all of the things, you're looking at sleep, you look at nutrients, you're making sure there's not foods that they're having immune reactions to, and you clean all those up, you can usually reverse that pretty quickly.
Cool. EBV, and this is a bunch of people are asking about EBV, EBV flare-ups, EBV and inflammation, anything that helps during a flare-up. And then additionally, if you have any perspective around EBV and maybe long COVID.
So yeah, EBV is a tough one, because Epstein-Barr virus, almost everybody's affected with Epstein-Barr virus. So, this idea that you don't have it is very unlikely. Most of us are infected with Epstein-Barr virus initially as a child or a teenager, young 20s. So most of us have EBV in the system, and Epstein-Barr virus is a very stable DNA virus. It's in the herpes virus family, which is a pretty large, a good sized family, which also includes things like chickenpox and herpes zoster and all that kind of stuff, shingles, etc. Epstein-Barr virus is a little bit unusual in that most people get it. It infects when we have the initial infection. We call it mononucleosis. It affects our monocytes, which are like our baby macrophages. So they're some of our immune cells. Some people have very bad reactions to it, so they get pretty sick, so they're sick for a week, they have to leave school, they've got huge lymph nodes, their spleen gets enlarged. Most of us, we don't even know we have it. We get a cold, we get a sore throat, nothing happens, we don't even think about it. But if you take 1,000 people and you check them to see if they have EBV antibodies, 98% show that they have antibodies against EBV. EBV, like most of those viruses that in the herpes virus family, they stay in the body. You can't get rid of them. Okay. So you can't cure them. Like, you can't get rid of it. However, our immune system keeps it under control. They don't come out and start replicating. So viruses stay inside of cells. That's the only way they can live. So they're not replicating themselves. They go into like a dormant state. Different things can likely reactivate them. And I'm not an EBV expert, but certain things, so chronic stress, all the things that we just, we talked about, other illnesses, some physicians and researchers, things like Lyme disease, mold, and not just regular mold, but like molds that have harmful mycotoxins. Not all mold does, but mycotoxin exposure, maybe other toxin exposure, anything like that, anything that also that can weaken the immune system. So like we said, stress, poor nutrition, et cetera, can allow that Epstein-Barr virus to then somewhat reactivate. So it starts creating some increased viral counts, viral load. At that point is when people sometimes feel symptomatic. Okay, so this is how you sometimes see it correlated with fibromyalgia, fatigue, and things like that. We also know that EBV may play a role in activating or starting autoimmune issues, right? But that being said, like I said, 98% of us carry Epstein-Barr virus. So it's not like this exotic virus. But unfortunately, some people do end up having reactivation. Uh, you know, I think that, you can certainly, we don't know about an effective, vaccine or pharmaceutical drug. We do know that other viruses in this family do respond to things like, let's just take herpes virus, valacyclovir or Valtrex, extremely effective, very safe, helps people out tremendously. There are certain herbs and things that have some antiviral properties that some people use with varying sort of success. But my understanding and what I have seen is that you want to work on improving your immune cell health and things like natural killer cells and T cells. And a lot of that is through nutrition, and a lot of that is through decreasing stress, or managing your stress, I should say, over time can be really, really helpful in, sort of keeping that under wraps. But I always tell people, like, listen, if you want to check your Epstein-Barr virus status, that is a routine lab that you can get from your primary care doctor or your internist. You can ask them to do what's called an early antigen D, which is the name of the blood test that you can get from any commercial lab. You don't have to, it's not a special lab test, to see whether or not you have a sort of a reactivation of Epstein-Barr virus.
Interesting. I did that. I had COVID in January, recovered, felt like I had a reinfection in probably late April, May.
Yep.
Was convinced, oh gosh, I must have COVID, tested. No. And then really started to feel like I had chronic fatigue, or which then kind of morphed into feeling like I had EBV. I never have sore throats, and I was just having sore throats and feeling a little fevery. And so I actually did run that lab and saw that I had elevated. Yeah, which I thought was just interesting. And I don't know if.
And had you had never checked it before to see if
I had
that was
never
an issue? Yeah.
run that specific lab, but I run so many labs and have done for the last 15 years that I feel like probably somewhere in there with all of the labs that I've done consistently, autoimmune stuff, like I feel like if I had these elevated Epstein-Barr virus, somebody would have caught it somewhere. And so I actually want to go back and do the test again. I'm feeling much better. It was rough 2 months. And so I actually want to run that lab again.
Yeah.
And see where I'm at. But it just, seems to be, that's an interesting thing that I was wondering if you've seen in anyone else or heard of.
I run it on, I wouldn't say everybody, but everybody who has usually a history of autoimmune disease, because, we're seeing some association with EBV, and there were some recent papers about multiple sclerosis as being a trigger, a major trigger, which is really, really interesting. And I would say, people with fibromyalgia and that kind of stuff, I don't run it routinely on everybody because, I'm not going to necessarily, do anything if it's just present, unless someone is really feeling, we're going to work on their immune system in a lot of other ways. But, I do sometimes have people use some immune support and natural antivirals because they don't hurt. And for some people, they do find them helpful over time.
Yeah, I wound up taking lauricidin.
Oh yeah.
Probably giving it an accent it doesn't need. It's probably not how you say it, but
Yeah, monolaurin. Yeah. Yeah, it's a
yeah,
derivative of a coconut. It's derivative of coconut actually.
yeah.
Monolaurin. It's a antibacterial and antiviral.
I felt like it couldn't hurt, you know, maybe it would do something
Yeah.
for the ABV and maybe it would
hmm
do something for my gut. And I felt good
It,
about
it can
it.
be good for a lot of things, cat's claw, and even some of the, some of the adaptogens. So, ashwagandha and andrographis is another one, which is really good for natural killer cells, which is,
Cool.
we'd like to strengthen. So
Cool. So you're telling us that drinking celery juice will not clear you of ABV? Is that the moral of the story?
yeah, unfortunately, I know I should have come up with that idea, huh? There's nothing wrong with celery juice. I
No,
mean,
just
just like there's nothing wrong with kale juice. I like celery juice and kale juice, and it's tasty and there's great nutrients. But as far as we know, there's no magical property of drinking celery juice alone that's going to cure
yes.
ABV.
So this is there's a few more community questions, but while
Sure.
we're here talking about virus, this was something I really wanted to ask you is have viruses been critical to our evolution as a species?
Um, you know, yes, we've always had viruses. As they were here before we were because they can infect other species, right? So it's not just humans that can have viruses. Um, and I think it's shaped our immune system, because obviously viruses can be, I don't want to say helpful, but they can transmit information. In fact, there's sort of this sort of intermediate of what's called a bacteriophage, which sort of acts like a virus. Like it can give us information to our cells without actually taking them over and killing them. Um, and so there is some data that viruses have some benefit to the human race. But unfortunately, some viruses, we call them stupid viruses. Some viruses are stupid in that they kill us before they're able to continue their species. So, for example, Ebola is a great example of that. Ebola viruses kill people too quickly before they can actually, stay and continue their wrath. But yeah, there is some data that viruses are here for a reason. I mean, most of us don't like to think that because we usually hate them and we're always trying to kill them. But unfortunately, they're going to be with us forever. And there's more and more that are jumping species. And that probably has a lot to do with how we're sort of treating our environment. Because, yeah, we don't want to be getting all of these viruses, but, they just we get closer and closer to the animal vectors that they're in. And so we're going to always be in the line of fire, and they're novel to us. So, all of a sudden we think it's a new virus, but it's actually been around for millennia.
And so something like chicken pox that I can remember getting it. I think a bunch of us can remember getting it. Is there anything that could be beneficial in that serves us later? Or is it just, it's in the herpes family, it hops in, it's not stupid, it doesn't kill us, it remains in our cells. We can't clear it
Right.
with juice, that's that. Or is there like are we having some type of more nuanced relationship?
Specifically with chickenpox, I don't know. I don't think so. I mean, it's not something, and in fact it comes out later and gives us herpes zoster, so we don't, it's not really something that is beneficial to us. So no, I don't think it is. But again, I think it's just one of those mysteries of the world as to why we have them. I mean, I think there are some viruses that help us protect against more dangerous viruses, as a way to sort of build up our immune system against them. But I don't think chickenpox is one of them.
No, so there's no beautiful symbiotic relationship of like the algae that lives on the whale that, I'm not remembering any of them in the animal kingdom now, but like, the beautiful symbiotic relationships we see. I was hoping there was
No,
one.
unfortunately, there's not. Not with
Okay.
that.
Um, allergies. And so we got a lot of allergy questions ranging from dog and cat allergies, seasonal allergies, dust allergies. Is it an overactive immune system? What is
So it is, it's different though. So, and in my book, I call it hyperactive, the hyperactive, sort of immunotype. The so a couple of major differences. So when we have a normal immune response, let's say to a pathogen, when I say a pathogen, something like bacteria, virus, something that's dangerous that we want to kill, we have a activation of a couple of different innate immune cells, and then we develop, usually we activate T cells, we activate antibodies of a specific class. So the class that we activate is something called IgG antibodies, and this is what the class of antibodies are against, let's just say, strep throat or something. They're IgG class, and they float around. We also have a whole class of antibodies that are called IgE. They actually look different. They look different than IgG antibodies, and they don't float around the body so much. They are mostly sitting on top of surfaces of the body. They somewhat float around, and they have a close relationship with mast cells. So what happens in an allergic immune response is different. So let's just say cat allergy, right? We breathe in cat dander all the time. All of us do. And that protein that is either part of the dander or the saliva of the cat gets recognized by these IgE antibodies. So if we have IgE antibodies that are specific to cat dander, what it's going to do, it's going to bind it up. It's going to attach itself to a mast cell. It undergoes this configuration change and causes release of preformed mediators from the cell. So you're going to have histamine, but it also attracts other cells like eosinophils. It can attract fluid to the system. So it actually creates this, what everybody recognizes as an allergic response. So that can be itching and sneezing and runny nose and hives. And in the case of severe allergic reactions, for example, to foods, it can cause anaphylaxis, blood pressure drop, that kind of thing. So it's a very different immune reaction than like what happens when we have an immune reaction against strep in our throat or a staph infection on our skin. And it generally happens very quickly too. So as to why people have it, that's like probably a lecture, but we know that there is a disruption in our sort of immune response in the gut. We know that there's microbiome issues that occur in people who have chronic allergies. Children can be set up for an increased incidence of allergies if they are not breastfed, that they are not, if they're not a vaginal birth, they tend to have higher incidence of that. Use of antibiotics and antimicrobials, excess antimicrobials, increase in toxin exposures. So all of these things can change our sensitivity and make us more likely to have allergies. So it's sort of very complex in terms of what makes us more likely. And then there is a genetic component too. I cannot dispute that. It's just that there's no single gene or single genes. We just know that it tends to track through families.
So would there be hope for a man in his mid-40s, my husband, a man in his mid-40s who has been allergic to animals his whole life, does not seem to have a family history of it. Could he potentially work on microbiome stuff and get to a point where he was not allergic to animals, or what would one do if they
So that
wanted?
would be the first thing. It certainly can maybe decrease it over time, right? Because you want to have a really good, strong, gut immune barrier. You want to have as many anti-inflammatory signals in the body. That being said, I have seen some people, their allergies change just when they move. It sounds crazy, but environmental changes. We do know that certain chemical exposures can increase allergies. So sometimes working on removing phthalates, parabens, pesticides, all of these things that can be additional burdens, can reduce your, sort of what we call atopy or allergic response. I would say those are the biggest things. And the good thing actually in terms of treatment is, allergy immunotherapy actually works really well. And I like it because it's a more natural way to sort of train the immune system to become tolerant of these things that are essentially not a problem for us, like technically we shouldn't be reacting to dogs and cats and horses and whatever. And allergy immunotherapy, which has been around for probably 120 years, is actually really effective and safe.
Yeah, doing that. We had forever in our fridge, like expired. All those
Yeah, unfortunately, you have to take it. You have to take it very on a specific time frame in order for it to really be effective. But it does work. I will say that in my years as working as an allergist, it was the most effective sort of pharmaceutical intervention. And what I like about it is that really technically these are natural substances. The companies, believe it or not, like grow pollen and they go out and they harvest it and they bring it in and they use it in their, so you can think of it as really almost like not really a homeopathic, because it's a much stronger than that. But it's a way of desensitizing. We call it desensitization over time.
And so setting our children up for success, vaginal birth, or if you have a cesarean, requesting that they do the swab and inoculate baby, breastfeeding as much as you can, judicious use of antibiotics.
Yes.
Lots
of like skin contact, right? You pick up a lot of bacteria from your mother, obviously from skin to skin contact. And also letting kids, I think that we are all scared about superbugs and staph infections and everything, but like letting your kids, crawl. I mean, kids are always putting stuff in their mouth, but like crawling around and not wiping everything off with bleach. Like, the likelihood is kids are going to, they need to sample the world. This is how your immune system learns. And unfortunately, this means kids get diarrhea a lot and they get sick a lot when they're little. But again, what we started doing in like the 80s was every time a child got a viral ear infection was treating them with amoxicillin and things like that. And we finally learned probably in the 90s that, oh, guess what? You don't have to treat viral infections. And every time you use that amoxicillin, you are damaging someone's microbiome. And so if you're doing it 3 to 4 times a year for the first, 4 or 5 years of a kid's life, then you're really doing a disservice. So be judicial. 90% of infections that occur in children are viral, not bacterial. And, it stinks. It really does. But unfortunately, they need to learn how to, to kill those things and to create a memory, arsenal of memory antibodies to, to be there when they get sick again.
Yeah.
So
playing with dirt.
I mean, I grew up overseas for the first 6 years of my life, and God knows what type of things I put in my mouth and was infected with. I think I had parasites and, and I, despite being an allergist, I have 0 allergies. And I consider myself lucky, and probably some genetics, but my mother has cat allergies. My sister has cat allergies. She was born in the United States. I was I just was very, my mother didn't believe in antibiotics. So I was very lucky. And so who knows?
Would it be too late to start now? Someone's listening and feeling inspired and they're like, I'm going to start playing in the dirt. I'm gonna, lick things that fell on the floor and like get down with dogs.
Yeah.
Do you need
I don't know
tile?
about dogs, but I mean, I kiss my dog all the time, so God knows what I pick up, but hasn't killed me yet. But this whole idea of getting soil-based probiotics, you probably, the SBOs, spores, we know that those can be very immune regulatory and helpful, and people take them as, they spend a lot of money taking spore-based probiotics. Well, those come from the dirt. I would not take anything off of a subway floor, right? But in terms of like, do you need to scrub your carrots? No, you probably don't. And I know that there's concern about that if you're getting it from, there's also been salmonella found on romaine lettuce, right? So, but maybe if you have your own backyard garden and you have good soil and you don't live in an area that has an old, lead factory nearby, and maybe you've tested your soil for heavy metals, you can have a little soil in your food. And obviously in this day and age, everybody should be washing their hands with soap, obviously, but that does not mean that you have to use hand sanitizer all the time unless you're working in a high risk area or you're dealing with people who are immune suppressed. So I think it's, we tend to go on extremes, and I'm not an extreme person. I'm like, listen, wash your hands with soap and water, period. End of story. It's not that hard.
I do. Okay. And then so we'll leave it for one last question. Doctor's choice. Why don't I read them to you?
Okay.
And then run with one. So we have questions around, and I personally had some questions just around energy for you. But we've got this MTHR mutation. I like to call it the motherfucker. And just lack of energy around that. And then maybe, like walking people. I think most of our crew knows what it is, and we've got people with it. There's a question around that. There's a lot of questions around histamine intolerance. And then there is a question around subclinical autoimmunity and how to test and detect.
So you're saying I can pick one of these because that's so much.
Whatever you're feeling called to.
Okay. Well, I can probably address maybe a little bit of, the autoimmune thing is pretty simple. So first of all, nobody is free. This is actually a good little factoid. Nobody is free of autoantibodies. Probably all of us have some autoantibodies floating around our body, because we're constantly making new immune cells. We're constantly, they go through a whole sort of developmental stage of learning to be tolerant to our tissues. So we have this way of deleting ones that are not. And so that it happens early on, so that it's almost like, in those cartoons when like something comes across and it either gets the check or the X, and then the trapdoor opens. So sort of think of it like that. Like we're constantly deleting what we call self-reactive cells. However, there's always a few that get through. And so none of us are free of that. And so you don't have to chase down, every little scrap of the possibility of autoimmunity. Now, that being said, if someone is like, hey, I have symptoms of, aches and pains and joint pain and skin changes and things that are like mystery, reactions. Yeah, you can start looking to see whether or not you have some typical autoimmune antibodies floating around. And the problem is with that is that not all autoimmune diseases create antibodies. So there's not always a diagnostic test. The big test that a lot of people screen for is something called an anti-nuclear antibody, or an ANA. If you have a positive ANA, that means that you have some antibodies that are directed against the nucleus of cells. Again, it's relatively nonspecific. There can be false positives with that. And then there's other ones that are more specific to certain diseases, like rheumatoid factor for rheumatoid arthritis, Hashimoto's antibodies for thyroid, what's called anti-TPO antibodies. Things like Sjogren's disease has some specific things, but there's probably 100 different autoimmune diseases. Many of them don't have diagnostic tests associated with them or antibody tests. So again, good thing to get screened if you're having specific symptoms, but not something that you necessarily have to go crazy about. And then I would say briefly, because it is very sort of popular right now, is this whole interest in histamine intolerance. Okay.
Mm-hmm.
So basically, what this means is that it's not that your body is necessarily making more histamine. It can mean, and it usually means that someone is having a sensitivity to the natural occurring histamine that is in many, 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 many foods. There's histamine that's in foods, especially fermented foods, certain dairy foods, fish, lots of different, because a lot of cells, especially of meats and fish and animal products, right, have histamine. So when you eat them, you have to break that down. And we have an enzyme that does that. So some people, for different reasons, start to have a problem with breaking down histamine. Now, there are other chemicals in foods that can sometimes cause a similar reaction. These are all in this category that are called bioactive amines. And this can cause reactions that can range from headaches to rashes to brain fog and all sorts of things like that, right? Separately, there is extremely rare. So like histamine intolerance, I wouldn't say is like super, super rare. I think it can happen. It can happen sometimes when you're having, we see this a lot with GI issues, because a lot of times it has to do with dysbiosis in the gut, or bacterial imbalance in the gut. More rare is this idea of mast cell problems. Okay. I would say that's pretty rare. Working as an allergist for years, I think I saw 1 to 2 cases in my entire 10 years of private practice in people who actually had mastocytosis, which is exceedingly rare and can sometimes even become malignant, extremely. But the thing with histamine intolerance is you want to get with someone who can work on your gut, look at, SIBO, look at yeast overgrowth, look at the health of the gut, the microbiome. And sometimes low histamine diets can be helpful in the short term. They are not things that you want to stay on for your life, because they are extremely restrictive. And we know that being on restrictive diets actually in the end can be really, really bad for you for multiple reasons. So,
yeah. And is there any relationship between hormones and histamine, like the estrogen connection there?
Yeah, so there is. And, it seems that usually around when women are having an increase in their estrogen, usually around ovulation, that this can interfere with our ability to break down histamine, or it competes with this histamine breakdown. So some women do find that if they have this issue, that they tend to get a flare up sometimes around ovulation, or when there's an increase.
It's a really interesting thing to track. Thank you for that.
Mm-hmm.
And then we could talk about the gene mutation, or maybe we could just end on, because I know your next book is around energy, right?
No, I haven't started my next book, but that would be an interesting thing. But yeah, we
I don't know why I had it in my head that I was like, yes, you're moving into energy. Okay, I made that up. But
yeah.
Do you have any thoughts around immunity and energy, and what's the correlation there?
Well, energy is interesting because there's multiple reasons why people might have low energy. And I would say that for a long time, I attributed energy issues to, I mean, and I'm talking like, if you take the sleep equation out, um, more to adrenal dysfunction. I think more so now it's a actual mitochondrial problem. So that really has to do with oxidative stress inside and stress on the mitochondria. Because if you think about it, where do we actually physically make energy in our body? We make it in our mitochondria. Like we've got billions of them in all of our cells, and we require nutrients and we require oxygen and water and all that kind of stuff, right? To actually have good mitochondrial function, because at the end we make this stuff called ATP, which is what fuels and powers our cells. And so if we can't make ATP, you have to look back, well, what affects that cycle? What affects inside the Krebs cycle inside the cell? So first is nutrient status, right? So that can be B vitamins, is a big one, magnesium, things like that. But also what damages the mitochondria? Toxins, one of the biggest ones. So environmental toxins, of course, toxins like alcohol, medications and drugs. We know that, for example, things like statins, right? We know that affects our mitochondria. That's why people get, sometimes bodily muscle aches with taking that. So I think that mitochondrial deficiencies and deficits, which I think in young people is more due to nutritional deficiencies, but then also toxins. Older people, same, but we also lose as we get older, we don't regenerate our mitochondria as much, and we eventually get smaller and smaller and smaller amounts. They always say, like, if you look at a 4-year-old or a 5-year-old and they're running like this, like doing zoomies, it's because they've got like billions and trillions of mitochondria. And you look at someone in their 40s, they don't have billions, trillions of mitochondria anymore. They're so I would say that's I think that's a big issue.
And is there any way for us to go back and regenerate and get to that place? I mean, I know there's mitochondria support, and when I had long COVID, I definitely was getting NAD infusions that seemed to really help. I was doing a suppository kind of in between the infusions. I felt that, and then just taking ubiquinol and PQQ and carnitine. I take vitamins and magnesium daily. Is there like another thing to throw in there?
Those are, I mean, you just hit about all of them. I mean, the PQQ, the acetyl carnitine is really great. Carnitine is something that's missed a lot. Of course, CoQ10 or ubiquinol. These are all great supports, and getting the variety of different all the other nutrients that get in there. And then also obviously fueling your body. So we see, what's interesting is a lot of people go on, for example, ketogenic diets, and they wonder why they don't feel well, because they cannot oxidize. They're not getting fat oxidized in traveling into the mitochondria, and they're oxidizing it outside of the cell. So they're completely depleted, because they've removed all their carbohydrates, and they're trying to convert 100% to fat, and their body's not fat adapted. And that changes also just individual to individual, and age and sex and things like that. So that's, but it sounds like you did a lot. And then of course, you needed time to recover, but another is to look at what's in your food, what's in your water, what could be potentially like, heavy metals, organic solvents, things like that can muck up the mitochondria.
Amazing.
Yeah.
Thank you. Is there anything that popped into your mind that you feel like this is just like a really cool fact and you guys need to hear about it?
I don't know. I feel like we've really covered the gamut. There's always tons to talk about, but that's I don't know. I feel like we really covered a lot.
I'm extremely grateful and impressed that you were able to really concisely and so cohesively walk us through all of that.